Oh. Take the money.
I want the swan.
Take it.
Oh, Abe, take it easy, man.
Hey!
No, my swan. No.
Alright, little Danny, breakfast is almost ready.
Okay, Mommy.
Let me turn off the stove.
Yo, what up?
Danny, carry on the family. Enrique, ¿por qué? No.
Because of Danny's traumatic childhood experiences, he started to suffer severe anxiety with specific aspects of his life. To cope with this, he developed compulsions and obsessions that helped reduce the anxiety that he felt.
There's general criteria required for a diagnosis of OCD. You must either have obsessions or compulsions. You may or may not realize that they are excessive or unreasonable. They are very time-consuming and interfere with your daily routine or social functioning. Your obsessions must meet these criteria: recurring or persistent thoughts, impulses, or images that cause distress. You try to ignore them with compulsive behaviors. Compulsions must meet these criteria: repetitive behavior that you feel driven to perform, such as hand-washing, or repetitive mental acts, such as counting silently. You try to neutralize obsessions with another thought or action. These acts are meant to prevent or reduce distress, but they are excessive and not realistically related to the problem they are intended to fix. These symptoms include repeated, persistent, or unwanted urges or images that cause stress or anxiety. You try to get rid of them by performing a compulsion or a ritual. These obsessions typically intrude when you're trying to think of do other things. They often have themes such as contamination of dirt or fear of having to do things orderly and symmetrical. They're aggressive or horrific thoughts about harming yourself or others.
Wait, no. Hey, Stefan.
Oh, hey Danny, dude, how's it going, man?
No.
hey, Danny, come on in.
Hey, Dr. Gamarius.
Oh, well, sorry, I forgot about your problems. So, Danny, I've been meeting with you the past few months, and do you have any symptoms that have advanced, or maybe any new symptoms you've found?
Nope.
So, what's the main reason you've come into my office today?
Well, lately, I've been feeling like I've been out of control of my life. I've been doing things that are abnormal, and I can't control whether I do it or not. And it seems like they're impulsive or a habit.
And have you been bothered by any unpleasant thoughts or images that repeatedly come into your mind, such as maybe a contamination or a severe event happening to you?
Yes, I repeatedly feel the need to wash my hands over and over again. No matter if I just touch something dirty out in public or if I'm in my house, I need to wash my hands no matter what. Because I feel like germs are going to make me sick or infest my body somehow.
And have you been worrying a lot about any bad things happening to you, maybe a fire or burglary?
Yes, I'm in constant fear that my house will burn down because I leave like the stove on or the oven on, and I don't know, I feel like I'm very scared to keep my doors unlocked, so I constantly check if they're locked, and because I'm scared of someone breaking into my house and hurting me or taking my stuff.
Have you felt driven to perform any acts over and over again, such as maybe checking to see if a window's unlocked or a door, or maybe seeing if the stove is on or anything like that?
Yeah, I always check my stove every time I walk by to make sure it's on or not on, and I do that about like 20 times a minute, and I do the same for my front door and every door in my house.
Does it bother you when things aren't perfectly organized? Maybe something isn't symmetrical with the rest of the room?
Yes, that is the worst! I hate it when that happens. My house has to be perfectly arranged, and all the books are in organized order, alphabetically, and my pictures, I use a level to make sure they're straight. It cannot be crooked. I hate that.
When you don't proceed with these compulsions or obsessions, do you feel like you develop any kind of anxiety?
No, because I've been washing my house, or my hands, and cleaning my kitchen just since I was born, and it's just normal to me. But when I was like getting these obsessions, yes, I felt some anxiety coming on.
Do these obsessions or compulsions, do they affect your life or your daily life or social relations with people?
Oh yes, I spend so much time cleaning my kitchen and washing my hands. I don't have time to do anything that I need to do. And I'm always calling my friends to make sure they're not in danger or getting hurt. And it's starting to annoy them, and they ignore me, and we're getting distant from each other. So I don't think I'm in control of my own thoughts and actions right now.
Well, Danny, I've been observing you for the past few months and hearing all the things you have to say and all the examples you've given me, and I think you have OCD.
OCD? No!
Don't worry. There's ways we can help you cope with this, such as psychotherapy. There's a thing called exposure and response prevention, which is kind of like we expose you to something that you're afraid of, and then we're going to gradually try to make you cope with the anxiety that you feel from it. And this will take effort and practice, but you will enjoy a better life, a more quality life, once you learn to manage with these obsessions and compulsions. And you can do these individually. You can bring in family to help you with it, even friends help you get along, help you cope with this kind of thing. And also we can put you on medication, some kind of antidepressant that can help you relieve some of the anxiety you feel and help you overcome these obsessions and compulsions.
Alright. Yes, that would help a lot. Thank you.
Hey Danny, you ready for our first therapy session?
Yeah.
Come on, so
No.
you're on good. Come on, just shake my hand.
No.
Do it if you're cool.
No.
Come on.
Okay. I need to wash my
No,
hands.
no.
I need to.
No, calm down. Deep breaths. You'll soon get over the urges. You'll realize you don't have to. No, No, you don't. No, just come stand over here. Stand over here. You don't have to. Say you don't have to right now.
No.
Say you don't have to.
Don't have to.
Good.
No.
No, no.
Tony, what's up?